Hi, I have a few questions for Boyd Haley. The birds that were mercury toxic, did they get it from fish, eating fish? Is that known?
Well, I didn't follow them around, but that's the speculation that when fish get mercury toxic, they get sick and they float up and they die on the beach. And people think eagles pick everything up that are fresh down deep in the water. They're not. They're fish that are floating on the water or on the banks. They're scavengers. And they eat fish, salmon, that are dead and highly mercury and lead toxic. I would point out, these birds were also had considerable high levels of lead.
Okay, next thing. You mentioned how the NBMI decreased tremors. Did it work in Parkinson's disease, do you know? The tremor of Parkinson's?
I'm reluctant to answer that because I don't want to be promoting the compound for a disease that the FDA hasn't looked at. But all I can tell you is that everyone we've seen that have tremors that have taken this compound have seen an improvement in their tremors. And some of them, not my diagnosis, I don't know how accurate the diagnosis were. They were heavily, looked very much like Parkinson's patients.
And another question. Is there any transient increase in the liver enzymes while the NMBI is being excreted through the liver? Is that known?
Yes, we have a result on that in a person that has ALS. And we brought the observation. Now, I don't have the data. This is all by an email, that his liver enzymes returned to normal 2 weeks or so on NBMI.
Okay, and it's not available yet to use clinically?
No, it's available if you go through all the loops. And I have nothing, this is FDA and EMA regulatory things. The person that was treated before was on what I call a single person or compassionate use in Switzerland. The Swiss are very good to deal with as far as the government being likely to approve a compassionate use for a compound that has passed phase 1 without a single adverse effect. So the Swiss, that's where it's being done. But it's being done under doctor's directions and with approval from the Swiss government.
Okay, and I want to make one comment here directed at Frank Schellenberger. I wonder, you mentioned how you're seeing a lot of people now that have chronic nausea. I wonder if it may be due to smart meters being installed on their homes and they don't know it. Just a thought.
Thank you for being teachers. I have 2 questions. First, one for the chemists. Last week I did a half-mouth revision of mercury on 65-year-old male that declined vitamin C IV. And he looked at me at the end and said, no, I'm not getting that. I'm going to take this. And he showed me a bottle of sodium thiosulfate. And I go, what's that? And so help me out understand. He says that's going to help him detoxify from mercury. Any comments?
I don't know of any studies that, I know that's been tried a lot without much success. It will bind mercury. Thiosulfate will bind mercury. I mean, but it probably will take it from your liver and other places and deliver it to your brain and places you don't want it. I don't know. I have not seen a study yet that shows that it removes mercury from the body. And I would be concerned about, that's not a real tight bond. It wouldn't be nothing like a chelation. We have 2 thiol groups around, and you might just be moving it around your body. So I don't know. I wouldn't do it.
So you're telling us it's a weak binder compared. Yeah. Okay. Question from Dr. Denton, who I work with. Mostly directed to Dr. Tennant. When do you get very insistent on people removing root canals? Like at what point do they have to be terribly infected, or maybe a little bit, or do you want all root canals to go away?
Well, I'm not the kind of physician that does a lot of insisting. I try to educate people and then let them make their own choices. But my personal belief is that any dead tissue in the body will come back and bite you. I think root canals are a lot like having a knot on the side of your automobile tire. You don't know when it's going to blow, you just know that it will eventually. And of course, I have a very personal reason that got me so interested in root canal problems in the first place. As most of you know, when I did the research for the laser that's used in LASIK, I got encephalitis and spent 7 years in bed. And during that 7 years, I had 2 to 3 hours a day in which I could understand a newspaper, and then I couldn't understand it anymore. And all of the best docs I could find said, well, you have 3 viruses in your brain, go home and die. So I had to figure out what was going on, and during the process of my figuring out how to get myself well, I had a root canal in number 14, which is spleen circuit. And as you'll recall from my lecture, spleen controls the voltage to the frontal lobes of the brain, the thinking part of the brain. And in addition, I had all the other problems that go along with spleen stomach, including ITP. As all of you know, a normal platelet count is 150 to 350. Mine dropped down to 30, and so I was bleeding under the skin. 48 hours after they pulled my root canal, my platelet count went back to normal. And my brain started working again, although my kids continued to claim that that's incorrect. That's my story, and I'm sticking to it. So, and interestingly enough, I had absolutely no discomfort in number 14 root canal, but when the dentist pulled it, there was so much infection in the bone around it that it splattered all over her mask. So the fact is that I personally feel I would be dead 15 or more years ago had I not had that root canal pulled. Obviously, I sort of have a personal feeling about how foolish it is to put in root canals. I think it's wishful thinking that you can sterilize dead tissue by any means whatsoever. So that's probably more answer than you wanted, but as you can see, I'm passionate about that.
Understood. Thank you.
Hi. Thank you for a fabulous 3 days of exceptional talk. I have 2 questions. One is having to do with the TCM, the traditional Chinese medicine herbs. I think I heard by itself, it doesn't really quite do too much. Synergistically, with 2 or 3 together, they can achieve similar nitric oxide effect. I think that's what I heard. And I'd like to know which herbs those may be.
We published that study in 2009, so if you go to PubMed and just put in Brian NS, you'll find that. The interesting thing was we took the raw mother extracts that I brought back from China, and those had the activity, and we were in the drug discovery business, so when you take those extracts apart through countercurrent chromatography and simple extraction methods, the activity fell apart. And so some of those actually, if you create the right environment, they'll generate authentic NO gas, and you can dial in any level you want. And then interestingly, when you add 2 or 3 together, you can quantify the synergistic effects that's been described. The 2 that worked the best was Danshin and Borneol. Those 2 seem to have some magic that no other 2 had. The interesting thing was when we published that paper, the postdoc in my lab became extremely famous in China. So we went to China, and I gave 8 lectures in 7 days in 6 different cities throughout China. And we toured several Chinese pharmaceutical companies that were manufacturing a Danshin therapy. And so I brought that back to my lab in Houston. And so the finished pharmaceutical product had 0 nitric oxide activity, although it started with this very efficacious mother extract. So it goes to tell us that, and that's the reason a lot of natural product chemistry and drug development fails, is because when you take the extract apart, the activity falls apart. Furthermore, through the manufacturing process, you kill a lot of the enzyme activity and the bioactivity. So the finished product that they're selling and prescribing in the Chinese pharmacies has very little nitric oxide efficacy. Now, it may be affecting other signaling pathways, but in terms of its authentic nitric oxide activity we detected, there was none.
Could you say the name of the second herb one more time?
Borneol, am I saying that correctly?
Oh, it's okay. I'll look up the literature.
Yeah.
Thank you. And my second question is with the calcium hydroxide. use on root canal. The reason I'm asking is sometimes I go out and do free clinic, like missionary work, and I probably will not see the same people twice. And I don't want to take out front teeth on young people. So I'm thinking this could be a very nice way to help them. But I'm not sure what is the proper application. How, like clinically, how should do I just plug it in and, how does it work?
But there is a chance for retreatment or just one-time visit.
I'm not sure if I will see them again, the same patients. A lot of them are migrant farmers.
Yeah.
So,
If you don't want to pull it at that occasion, you can just open the root canal, clean and shape the surfaces, and leave the tooth open. Because it will serve as a drainage channel, and the stuff starts draining out. And the necrotic tissue that remains in the dentinal tubules eventually disintegrates. Because all those microorganisms actually form to chew it up and actually transform it into basic, dust. And so the only thing actually when you die that remains are teeth and bones. So with this kind of approach, you can allow the organic matter to die properly, to die off, to be, how do you say? Yeah. And so it actually flows out. And this is a way to keep, at least for some time, in younger person, and there is no need to fear that infection will come from mouth in the root canal, because that's wrong. Infection forms within, because there is necrotic tissue that needs to be cleared, and all the fungi, all the microorganisms, that's actually natural circle to break down, the structure, the organic matter to base elements, minerals and amino acids, and the fumes, the toxic, gases that form can go out through the open root canal, instead of, when you fill the root canal with root canal sealers or with gutta percha, then you cork it, you close the valve, and of course those toxins will go in the bone marrow, and this way you can leave it open and work it as a chimney or drainage channel.
so just keep it open, and there's no concern about food getting in.
I would respectfully disagree, because those tubules are 30 microns. They're very, very tiny, and I think that you're just setting up a time bomb to explode. And in a perfect world, maybe that would happen, that things will disintegrate. But we don't live in a perfect world. You may never see that person again, and there's going to be a hole there. How's that patient or that individual going to go inside that tooth and keep it clean? And if maybe they could ozonate it or keep it flushed or whatever, maybe that would work. But I think that I think you do a better service for their health in the long run, because it's a dead tissue in a human body, and I do not know of any medical procedure in the world that encourages you to keep a dead organ in the human body. So, Jerry?
Just reply.
I just want to say one thing. Most of you remember the Topaz test, where we could measure the toxicity in curvicular fluid. And we did a study with somebody, and I can't remember who, that was going to change root canals or treat them with Biocalyx, and with the idea that this would fill up those and prevent them from becoming infected. And the dentist did an outstanding job, because he sent us the stuff a day or two after he'd done it. There was no toxicity in the curvicular fluid of teeth given root canals with Biocalyx. But 6 months later, they were toxic as any other root canal you've ever seen.
Sorry.
I would just want to remind you of a basic law of the universe, and that is the function of fungus on the planet. Were it not for fungus, we would all be over our eyeballs in dead animals and dead leaves. Because the reason that fungus is on this planet is to take dead organic material and turn it back to dirt. And so if you think about the leaf on a tree, that leaf will have fungal spores on it, but as long as the leaf has voltage in it, it will have oxygen, and as long as oxygen is present, the fungus will be suppressed. Once the leaf dies and falls off the tree, the voltage goes away and thus the oxygen goes away, and that is the signal for the fungus to wake up and do what fungus does, and that is take the leaf and turn it back into dirt. Now the same thing happens in our bodies no matter where you are in the body. Fungus doesn't understand that one organ might be dead and another alive, but anything in the body that loses its voltage and loses its oxygen will have fungus wake up and do what fungus is supposed to do, try to destroy that tissue. And of course that is the origin of people like Tullio Simoncini's theory of fungus causing cancer, because it's always present. But just because it's always present doesn't mean it causes it. It is actually something that occurs. So anytime voltage drops, oxygen drops, anytime you're hypoxic, fungus will show up and start putting out the toxins that Dr. Haley so elegantly defined as the gliotoxins in dentists. But I just want to remind you that no matter where you are, any living organism, when it loses oxygen, fungus will try to destroy it.
I'm going to say...
I would love to, but you know, there are 3 replies, and I would take too much time to reply to all. But I suggest to all that weren't at my lectures to check out and try it themselves, and at least try to understand what is it all about, and try in your practice and see if it works. You know, I did the Orotox testing, and I stopped because it always went down. Now I know this, but you know, and regarding fungus, they're always the result of necrotic tissue. They form because necrotic tissue is there, and this is the basic teaching of André Béchamp, you know, the beginner of pleomorphic theory, and it was always the terrain that determined what's gonna occur there. And if a tissue loses its voltage, of course, different life forms start to form out of the nanoparticles of life within our cells, within our plasma, and they form, as can be seen, if you use the dark field microscope, they form fungus to control and to decompose the organic tissue. But you know, there's only so much organic tissue in dentinal tubules, and if you leave the fungi and the microorganisms to decompose it, and if you can, you know, provide a channel to drain it out of the tooth, then at some point there won't be any organic matter within the tooth structure.
Well, I agree with you know, the fact that we talked about the terrain, and of course talking about the terrain talks about voltage and oxygen. But if you look at pleomorphism, it has been shown that much of what was published by Gunther Enderlin in the 1950s and by Naissance in France, where these little particles, these little round things that seem to accumulate and get together, they believed formed microorganisms, and that's been completely shown not to be true, where those small particles that they each gave different names to, one French, one German, and so forth, have been shown to be microcysts. And these microcysts are the intracellular signaling system and have nothing to do with forming microorganisms. So you have to realize that the technology and magnification things we have now have really proven that much of what Enderlin and Naissance thought was correct is incorrect.
What about the work of Professor Dunbar? He actually proved he could, turn from algae to bacteria and back to algae just by changing the environment. That was the beginning of the 19,000, previous century.
I want to switch this a little over to the legal, ethical aspects that you would find in the United States of leaving a tooth open and untreated. In traditional dentistry, you would run into a number of ethical problems and legal problems with your boards. That is not considered the standard of care. And here is the practical aspect. Please believe me, because I know these things from personal experience. State boards will not take that as a proper standard of procedure. So be careful. I understand it's outside the states. And here, go ahead.
It's okay. I'm just trying to defend.
Well, it's okay. It's outside the United States, but I'm just trying to say that what would happen here. That's all.
Yeah, but first of all, you're an 18 or 16-year-old boy with a problem with his frontal teeth, and the doctor comes and says, we're going to pull them out. You don't even have the money for replacement, but you have an alternative that I presented at my lecture that can be and proved. It proved, I showed pictures. It proved it can work at least for some period of time, at least to wait till he's 18 or 19, so his bones start growing.
Okay, this is directed to Dr. Schellenberger or whoever else can answer it. For those of us that don't live in Colorado, how many cannabis products are available for physicians to prescribe for their patients?
Okay, so you can get CBD with all the terpenes, with all the other cannabinoids, except THC is going to be less than 0.3%. You can get that in all 51 states. Like I said, we even have people in our exhibition center that are selling that. So I've been asked this a lot, but if you want to get some CBD, just go out and, you could go online, or you can go see one of the exhibitors, and you can get it. They'll mail it to you. It's totally legal, no matter where you go. Now, there's no THC in it. But that's, and for one of the things I wanted to impress upon you was, in my experience anyhow, and certainly also when you look at the literature, it seems like the main therapeutic component in marijuana is CBD, not THC. And you can get that legally anywhere. They have it right there in our exhibition center.
Okay.
Yeah.
This was good. Hey, what's the 51st state? I may be behind the 8 ball. You said
Did I say 51?
Yeah.
Oh, I'm just planning ahead.
I thought you looked. Maybe Puerto Rico, I was thinking.
Yeah.
49 in Texas.
I have my first question is for Dr. Tennant. Dr. Tennant, as far as the pH is concerned, the polarity reversal, what is the pH that polarity reverses to plus 30? And also, I've been taking fulvic minerals, and it's been helping tremendously in raising my first morning urine pH. And I'm doing other detox protocols. If you can elaborate on any methodology that, other than cleaning infections, inflammations, and all of that, and biomodulator in raising the pH.
Okay, well, if I understood the first question, it has to do with the relationship between voltage and pH. So if that is indeed the question, then by convention, well, first of all, let me say it this way. We have two types of electricity in the sense that we have conductive electricity, which are the electrons in the copper wires that are lighting up this room, and then we have electrons in a liquid. And when you have electrons in the liquid, you have the possibility of it being an electron donor or electron stealer. And so you use a sophisticated type of voltmeter, if you want to call it that, to measure the voltage in a liquid. And by convention, if the voltage you measure is an electron stealer, you put a plus sign in front of the voltage, and if it's electron donor, you put a minus sign. And also by convention, plus 400 millivolts is a synonym of a pH of 0. Minus 400 millivolts is a synonym of a pH of 14. And pH of 7 means that it's neutral. It's neither a donor or a stealer. So then if you get a pH meter, there will be a switch on said meter, and you can switch it into pH, in which case it will read the pH, and then you can switch it to millivolts, and it will automatically convert that for you. And so what you will see is that cells, well, any cellular biology book will tell you that cells are designed to run at a pH of 7.35 to 7.45, which is a synonym of saying cells are designed to run between minus 20 and minus 25 millivolts. Now, remember, as I said in the lecture, that's the environment. If you were to take a cell and put an electrode inside the cell and one outside the cell and measure across the cell membrane, you'll get about 90 millivolts. But I hope you don't have very many of your cells in a petri dish. So what we're really looking for then is we want our circuitry to be running between minus 20 and minus 25, and then to make new cells you need minus 50. Did that answer your question? Yeah. Okay, well, there was a second part of the question.
The relevance of fulvic minerals?
Oh, yeah, it was about switching polarity. Thank you. Well, anything above a pH of 7 will be an electron donor. And anything below a pH of 7 will be an electron stealer. And therefore, you go from minus to plus voltage, right? Just by simply going through 7. So what Brewer showed in his work, and by the way, Brewer is an interesting chap in that he was a physicist who looked at cell membranes and thus had a different take on what he was looking at. But Brewer showed that normal cells run at a pH of about 7.4, and cancer cells always run at 6.5. Well, 6.5 is a synonym of plus 30 millivolts. So basically what Brewer said is that you go from minus 25 to plus 30 when cancer occurs. He did not say in his publications, but it's obvious when you understand what we're talking about, that to go from minus 25 to plus 30, you have to flip the polarity. And of course, it's also known, well known in battery technology, that anytime you take a rechargeable battery and drain it to 0, in other words, completely discharge it, it will flip its polarity, which was one of the reasons that when we had older versions of rechargeable batteries, if you ever let them go to drain completely, you could never get them to recharge again. So it's going past 7. That I believe, and of course this is theory at this point, but I believe it's that flipping of the polarity, which is the signal to the stem cells that, hey, we just ran out of oxygen here, please make us a placenta so we can survive.
And then the effect of the fulvic minerals on the pH?
Well, there are only 2 substances that I know of that in and of themselves have the ability to be either plus or minus, and Dr. Haley may be able to correct my understanding of that since he's a chemist and I'm not. But hydrogen can be either plus or minus, and fulvic, which is a type of organic acid, has the unusual and unique ability to be either plus or minus. So the fact is then that fulvic has a function in controlling what's going in and out of cell membranes because it can change the polarity as needed. Now there is one other system in the body that all of you know about, but maybe haven't thought about, that has the ability to do that through a mechanism, and that is our carbonic acid buffer system. So when you have when the body makes acids, of course, which is the end result of most metabolism, those acids will combine with bicarbonate ion and form carbonic acid. Then carbonic acid has the ability to break into CO2 and water. You breathe out the CO2, and all you got left is water. So here we start with something that's an electron stealer and end up either neutralizing it or having it to be electron donor. So that's, of course, one of the main ways that voltage is corrected. Now, I didn't realize this until recently, but as Dr. Bryan has taught us so eloquently, essentially everybody past the age of 40 is deficient in nitric oxide. Well, it turns out essentially everybody past the age of 40 can't make enough bicarbonate ion either. So almost all of us are deficient in bicarbonate, and therefore it behooves us to take enough bicarbonate every day to keep our salivary and urine pHs just slightly in the purple.
So other than the biomodulator, what other, is first morning urine pH a good indicator of the extracellular matrix pH?
Well, I don't know if I'd use the word good. It is an indirect indicator of what's going on. The urine more closely reflects extracellular fluid. Saliva more closely reflects intracellular voltage. But neither are very perfect because they're altered by so many different things. Whether you're dehydrated or not, what did you eat with your meal before you went to bed, et cetera, et cetera. But they're close enough guide, I think, to help you know whether you should take a half a teaspoon of baking soda this morning or not. I don't think they're a good enough guide because when I measure voltages electronically of the various circuits, I don't find there's a terrific correlation between that and what I get with a pH strip.
Thank you. My next question, if I may, is for Dr. Bryan. In dentistry, we use a lot of antimicrobial agents. Now, as biological dentists, we switch to ozone, nanosilver, essential oils. But don't all of that also affect the facultative anaerobes, and doesn't that really have significant consequences on NO production as a result?
The short answer is we don't know, because the bugs that we're culturing and are interested in are on the dorsal part of the tongue. As a dentist, from my understanding, you're interested in the gingival and the communities that are on that part of the surface. And we know there's crosstalk between these different communities in the geographical areas of the mouth. And so we know chlorhexidine is very effective at this. We haven't, and this is a very good question, it's probably the most common question I get, what effect does hydrogen peroxide, ozone have on these? If you're doing ozone trays and you're just affecting the gingival tissue, then it's probably not likely affecting the bugs deep in the crypts of the tongue. If you're using a rinse and it's getting into the crypts of the tongue and it's antimicrobial, then my best estimation would be that you may be affecting these communities. The good news through all this is, and we've done this in the past month and we're getting ready to submit this publication, is that these bugs repopulate very quickly. The problem is, and the challenge is, when you eradicate them with chlorhexidine, the diversity of the communities change. And then, these are communities, then they feed off metabolites of different communities at different layers of these, the layers of the communities of bacteria. So we're trying to answer all these questions. We've submitted grants to NIH. NIH is not very favorable at funding studies like this because it's against the norm. But I think we're making enough headway to where if we get these studies funded, whether we get them funded or not, we're going to do those experiments to figure out, does regular Listerine do it? Do a lot of these essential oils, oil pulling? Again, how is all these things that is oral health professionals, are you doing more damage, more harm than good long term? But these are all very important questions. But the overall, I think, paradigm is the fact that if you're eradicating good, commensal, non-pathogenic bacteria, then bad things happen. Whether you're doing it on your skin, in your mouth, or in your gut, these bacteria are there for a reason, to do things that we as humans can't do.
May I add something to that? Do you mind? As an ophthalmologist, I have the unique advantage of having the equipment to allow me to photograph serially the vasculature of the retina, which represents the vasculature of the rest of the body. So I have a particular interest in watching what's going on with circulation. And certainly always, with people have wet macular degeneration, I can reverse that and stop it. But if they go home and they quit taking their Neo 40, usually within about 2 or 3 months, they bleed again. So it's, of course, wet macular degeneration is pure and simple hypoxia, which causes neovascularization in the macula. Well, the other thing that I've noticed that is helpful, it's not nearly as powerful, but I think it's helpful, is the addition. When I see people who are on the Neo 40 and their vascularization is still not very good in their retina, I always add sulfur. So why? Well, when you eat sulfur, eggs, onions, garlic, broccoli, etc., it eventually ends up underneath the skin. And then if you expose yourself to ultraviolet light, namely get outside, then the the infrared light then converts the sulfur into sulfate. So it wraps oxygen, electrons, and the sulfur into sulfate. And then it hooks it to a cholesterol molecule, and so now cholesterol sulfate goes inside of red blood cells. And when you have cholesterol sulfate inside of red cells, it creates zeta potential, which is basically a fancy word for a magnetic field around your red cells. So the cells push against each other, that is to say, push your red cells apart to keep you from clotting. In addition, the sulfates are attached to large molecular weight sugars, and those are deposited inside the endothelium. So both the sulfates in both of those forms form a magnetic field. And so now if this is my endothelium and here's a red cell going along, there is a drag that the red cells create on the endothelium because one magnet's pulling on the other. And it's that drag on the endothelium that tells the endothelium to make nitric oxide. So one of the mechanisms of increasing your nitric oxide level, in addition to the Neo 40, is eat your onions and garlic and eggs, but you have to quit being a gopher and spend some time outdoors. So, of course, most of us are gophers or moles. You know, we're inside, we get in our car, we're in our office, and so we're indoors from dark to dark 30. And so you really have to get outside in as few clothes as the law will allow. But remember, there's just as much infrared light outdoors at night as there is during the day. I don't know if you knew that, but you can get the effect by just going outside at night. So it's another way to make your circulation better. Thanks.
Skinny dipping.
Thank you to our speakers. I just need to make an announcement. If someone has found a phone, please bring it up to the AV Center. There's a phone that's missing that if anybody knows or has found a phone, please bring it for us. And again, thank you to our speakers. We cannot entertain any more questions because we now have to be prepared for the showing of the Vax movie. Thank you.